Hey y'all, and thanks so much for coming back to my channel. I'm so excited today to share this video with you guys. For those of you that follow me on Instagram, you probably remember that I had my first microneedling treatment last Tuesday, and I mentioned on Instagram that I would actually be vlogging this entire process from start to finish with you guys. So today's video is all about that first official session that I did and how it actually went, how the treatment was, pain level, all that good stuff. You guys are gonna get some up close and personal scenes here on my face of how the needles actually work, as well as understanding the process. So if this is something that you've been looking into for yourself, you're definitely gonna wanna keep watching to kind of see how it goes. And then of course, as always, please subscribe to my channel. I would love to have you become a part of the Reformed Tomboy family here and join me in learning a little bit more about beauty, hair, makeup, all that good stuff. So hit that subscribe button and as well as that notification bell so that you can get notified when I upload new content. So for now, let's go ahead and jump right in, and I will see you guys at the end for a quick little blip about how my face is doing today. I guess that's what, 10 days out. So I will see you guys at the end. Hey guys, so I'm actually getting ready to head into Linda's for my first treatment for microneedling. I'm super duper excited about this today. I have been wanting to do this for a few years just because of having acne and having like bigger pores and scarring and all of that. This should really help to rejuvenate my face. So I'm headed in today. I literally just left the gym and I'm rushing home to go wash off my face. I have to go in completely naked face today, which y'all know I hate, but whatever. So I gotta do that. I'm gonna put my numbing cream on. Hopefully I don't feel this too much. I don't know. I've read a lot of things. Some people say it's painful, some say it's not. I have my eyebrows microbladed. I didn't think that was painful. So I don't know, I think it'll be fine. So anyway, this is my first documentation of that process and I will keep you guys posted as I go. I will start with, I think 3 treatments is what we're starting with. And then I will actually, after that, depending on how well it goes, I will possibly need more. I could need up to 6 due to the fact that I have had acne. So we will kind of see exactly how many I need as my face heals, but I obviously can only do this once a month just so I have the healing process. So anyway, that is my first vid on that, and I will see you guys soon as we start the procedure. All right guys, so I'm here for my first microneedling treatment. This is Miss Linda Goforth. And as I mentioned earlier, I'm here at the Aesthetic Center and this is like the place to go for any of your facial needs. She does microneedling, she does Botox injections, lip injections, they do facials here, dermaplaning, permanent brows, everything. So this is like the best place in Sarasota. So if you live anywhere on the southwest coast here, I don't care if you're an hour and a half away, drive here, this is the place to go. I searched high and low for someone that I could entrust my face to. Obviously it's my moneymaker with what I do. So we're gonna talk a little bit about the procedure and what I'm getting ready to do, and she's gonna kind of explain some details.
So we're going to do microneedling. Lauren's issue is that she's concerned about her texture of her skin. And so what we're going to do is we're going to enhance that. And this is what I do when the patient comes in. I always kind of go over the steps of what microneedling will do. So basically, by using the little tiny needles that'll inject into the skin as deep as 2 millimeters deep, okay. You go through a cascade of events that cause collagen. So this is the cascade. Cool. So the little micro trauma, and then we get down to the inflammation, which makes growth factors, which is really important, which also stimulates fibroblast cell multiplication, and then we get collagen elastin synthesis. Okay. So that's the cascade of events that occurs just from doing this little treatment. Okay. Normally with collagen, if you're worried about texture and tone or acne scars, it's usually 3 to 6 treatments, usually spaced, usually about 2 months apart, typically, at least 21 days apart. But I usually tell everybody just kind of maybe space it out about 2 months, and I think that's really great. You get a beautiful result.
Cool. So can you talk a little bit about the growth factors emission? Because I know that's something that is really different here. Is it the human growth factor?
Yep.
Can you talk a little bit about that?
Yep. We actually, with the human growth factor, basically is a wonderful way to do repair work. Okay. It's more than just putting hyaluronic acid into the skin. So I do use a line called LC Cell that actually has human growth factor in it, and it comes from adipose tissue. Sweet. So it's wonderful. So not only with microneedling, but we're also going to put that on the skin, which absorbs into the skin, and that really does a lot of the bulwark, basically.
Cool.
So, yeah.
And this actually too with having collagen, can you talk a little bit about that? Because some people really don't even know what the details of this are. So I know that I'm going to look younger, which is always a bonus.
Yeah.
So talk a little bit about that too.
So collagen induction to any type of trauma or certain products as well that'll help stimulate collagen. You usually will start to see the improvement about 3 months from now.
Cool.
So even though we'll be doing your treatment today, she's gonna look red and she'll look rosy, she'll look healthy, she'll look glow. Yeah, exactly. Right? But the real work is gonna it takes us a 21-day cascade of events that occurs with the inflammation from the inflammation to the correction, and then from that, within 3 months, you start to make collagen. So it's one of those things that you won't see immediately, but you'll see as time goes on, and it really does work.
So guys, I think that's important to understand, just because a lot of y'all know that I've got my eyebrows microbladed, and I think that the common misconception with this stuff is that you walk out and you're like, cool, I look amazing, and it doesn't. It's a process, and so I think that's kind of why I'm really excited to document this, is for people to see the healing process, to see what my skin looks like before, and to kind of document photos over, if it takes 3, 6, however many treatments, to everyone to see that progression. So, okay, so we'll be back in a few with actually getting under the chair, so see you soon. Okay guys, I got my little hairnet on, so I have like this clean area for my treatment, and I want to show you guys just how clean everything is here in Linda's place. One of the things I really love is that she is super, I'm talking like meticulous in particular about cleanliness, just the overall atmosphere here. It feels like a hospital and so sanitary, and so I think that that's one of the greatest things about this place, is that they truly are looking at every detail. So not just the cleanliness, with that being said, they're even looking at every detail with your face. Everything's going to be symmetrical, or you're going to get the result that you're looking for. So I think that's something that I really wanted to point out about this. So I'm going to show you guys exactly kind of what I mean about how sterile this place is.
So I feel like it's so important when you are trying to find a place to do procedures like this, that you look for somewhere that has great ratings and that does take care of their facility, because again, they are messing with your skin.
My treatment.
So this is chlorhexidine, which is what they use like a pre-surgical or cleanser. They use it in the operating rooms. And I always just like to make sure that I'm not going to penetrate or implant any bacteria under your skin.
Awesome. And some people do the neck, and obviously I don't need to do that. But why would somebody do their neck?
Just to make collagen. Just if the neck starts to look like the texture is getting rough, and and they're getting laxity, that'll help make more collagen.
Okay, got it.
Yeah.
So this is really something that anybody of any age bracket can do?
Absolutely.
Okay.
Absolutely. After age 80, they don't make collagen as well, but honestly, I have a patient who is 80, who her hair has grown back beautifully because I did microneedling for hair, and it looks incredible.
Oh, wow.
Yeah, her skin is to be envied. She looks incredible. So I know they usually say that you stop making collagen like in your 80s, but she's obviously making something because she looks incredible.
That's awesome.
Yeah, she looks amazing.
Okay, very cool.
There. So now what I do is I'm going to alcohol off the skin a little bit, and the reason I'm doing that is to make sure there's no soapy residue on your skin.
Okay.
Because again, I don't want to have to implant that into your skin. A strong smell though.
Oh, I actually don't mind the smell of alcohol.
I know it smells clean, doesn't it?
It does. That's why I like it.
Looks like you're good. Oh, that's interesting. Still took off some. Okay, let's do a little more.
Well, and I did work out this morning, but I went home and washed my face with a very gentle cleanser.
Yeah, that's good though.
So I wanted to make sure that I got in a workout today, because I know I can't do that for 24 hours.
Correct.
So,
Yeah.
And is it no makeup for 24 hours too?
Yeah, you really shouldn't.
I won't.
Yeah. And you're gonna look rosy, kind of the way you look right now.
Yeah, that's totally fine.
I think the numbing cream has a little color to it too.
Oh yeah.
Could be part of what it is. Yeah.
Well, and I lathered it on.
Okay, good. Good.
I
awesome.
did.
I showed you what the cartridge looks like. So there are 36 little needles in this.
Holy moly.
So yeah, basically they come out the top, and they're very fine. They're very tiny.
Oh, that's good.
It's actually very comfortable. So we'll do your forehead first, and we won't go too heavy.
Okay. Wow,
Yeah.
that's crazy.
A couple.
So what's this part?
So this is actually putting the human growth factor on top of your skin.
Whoa, okay.
So I'm just going to move it around just very gently first. And just check my measurement here. Just going to kind of just smooth it around first. Smoothing it. Okay, now we're just going to do 0.25 millimeters. We're just going to go very, very shallow.
Okay.
Not very deep at all. Okay, so we're going to do 3 different patterns. Okay, so 1. And you may not feel much of this.
Oh wow, no.
Not bad, huh?
No.
Okay. So we'll go a little bit deeper.
Wow, that's crazy. When I had my eyebrows microbladed, I mean.
Yes, see the numbing cream. It's the difference in the numbing cream.
Yeah, you could definitely feel that. You could hear the scraping motion.
Yes.
You can. I mean, I can hear the sound here.
Right.
But this reminds me of when you go, like, you watch your husband get his hair cut.
Yeah, it sounds that way.
Yeah.
It does. Yeah, exactly.
I would have no idea that needles were being pricked into my
Yes.
skin right now.
Isn't that amazing?
That's awesome.
Yes.
Oh, I'm so happy.
So the numbing works really well.
Yeah, that's great.
I'm going to go just a little bit deeper
Sure.
on purpose, and I'm just going to go in a different direction now.
Yeah, again, no feeling, guys.
Great. We're covering every square inch here.
That's so cool.
Your skin's looking rosy. That's what we want.
Cool. And do people bleed? Probably
Yes,
somewhat.
They do.
Okay.
Yeah, they do.
I remember seeing a picture of like Kim Kardashian after she got
Yeah,
this
it's very
done, and I was like,
bloody.
yeah.
Oh yeah. Well, you do want to bleed a little, and that's our next step. We're going to actually go a little bit deeper on the next one here.
Cool.
Yeah. The bleeding's good. You have to get a little.
Yeah, when I've done other therapies, well, like acupuncture, for
Yeah.
instance, I've done acupuncture for injuries when I was personal training,
Yeah.
and the whole purpose of that is to, get your body to heal. So it has the blood actually release.
Correct.
Yeah.
How's your comfort there? I'm going deeper now.
I can feel that a little bit, but it doesn't hurt.
Not terrible?
No, in fact, I would say that it's just more that you can feel it on your bones.
Mm-hmm. Right. There's very little fat on your forehead.
Right. One could hope, right? There's
Yeah,
little
I know. Exactly. So you definitely feel it. Good. And you're nice and rosy.
Sweet.
Yep. Awesome. All right, so let's do the other side.
Okay. Yeah, this is the only one that you feel, but it's not a painful thing.
It sort of feels like a cat's tongue. I don't know. Does that
Yeah.
make any sense?
No,
It's
it
rough
totally
like a
does.
cat's tongue.
It does,
It's
actually.
the only way I can sort of even describe
That,
it.
yeah, and I have 3 cats, so I know
Yeah.
exactly.
That way. It's just like a rough, weird, interesting
Yep.
feeling. So I'm going to do just a little bit extra where the texture is,
Yep.
you're having a little bit more issues with the larger pores.
Yes.
I'm just going to do a little bit of stamping, okay?
Mm-hmm.
And then you let me know if this is too uncomfortable, though. I don't
Okay.
want to overdo. Let me know. Scale from 0 to 10. How you doing?
About a 3.
Okay, tolerable or not
Yeah,
tolerable?
I mean, it's a little more
A little
discomfort,
ouchy.
but it's not, no.
Okay. a little more tissue trauma, and that's going to give a little bit more of the inflammation, the cascade of events that'll cause the collagen production.
Cool. So for those that like don't know, I've talked about it on my YouTube, but I had cystic acne growing up. I had regular acne. I was like one of the first kids in elementary school, like 5th grade, to start getting zits, and it sucked. And so then I just had it my whole life, and we're talking like cystic acne where I would have 2 or 3 or 4 layers underneath the skin, like right on top of each other.
Goodness.
So that really caused a lot of the damage on my skin. And so that's one of the reasons I really wanted to do this. Because of that, my pores obviously were larger from just being inflamed. So that is just, you know, one of the reasons why this was so important for me to do.
And this is one of the best methods to help with acne scarring. It really is.
Okay guys, I just had my first treatment. I am done. My face is a little rosy, and she definitely went heavier in those areas where I have more texture on my cheeks, on my chin, and I think there were some other places even on my nose a little bit. So I'm so excited about the results. Actually, my skin does look smoother already, and some of the pores already look smaller. So I'm already noticing just a visible difference just from having this done. So I will keep you guys posted with pictures and videos of my healing process, and then of course the next time that I do this as well. Hey, good morning guys. I wanted to do a really quick little video for you guys to show you my face this morning. I'm out here on my lanai because I feel like I get really good lighting and you can kind of see how it actually looks other than my bathroom. So I am super impressed today. We had a late night last night, so my eyes are a little puffy just from being up for a long time. But my skin looks so smooth today, like on my cheeks, and it just looks overall better. I realize again I still have like 21 days or so of healing to go through with this, and that my skin is going to kind of cascade and go through several events that you'll actually see in this video. But at any rate, I'm super excited with how it is looking, and I cannot wait to put makeup on this canvas today because it's just, I don't know, it's so soft and smooth, and some of my pores even look smaller. So I'm so excited to continue the treatment process with this and actually see the final results. I hope you guys enjoyed all of that content and just kind of the process from start to finish of how it actually went. I must say that I'm 10 days out from the first actual treatment, as I mentioned in the intro. And you guys, I'm not technically supposed to see any results until after like 3 months down the road, because obviously, like anything, when you do something like this, you don't get instant results. Your body has to go through a healing process. Obviously, when you start it, you're creating injury and inflammation, and then you have to heal from there. But I do want to say that I have noticed some changes. And obviously, you're your own worst critic with your face. So I think, you know, in general, we all all are gonna find things about our faces that other people don't notice. But what I do wanna point out that is exciting for me is that obviously you guys got to hear that I did struggle with cystic acne most of my young adult life, and actually up until almost my mid-20s. So somewhere around like, well, probably early 20s, 22, 23 was when I finally started to get rid of it. But anyway, I am actually seeing like less texture here in my skin. I have my pores. Actually, there was a huge acne scar that I had right here, and it was like these two little deep pores that were like puncture wounds almost. And so that's a lot of times, one of the reasons I love full coverage makeup is because I can hide some of that stuff. And I have on a full coverage foundation today, but it looks so much smoother than what it has in the past. And I'm wearing the Tarte Amazon Clay for those of you that care. But it does look smoother. My makeup is going on smoother, and I've noticed that there's a lot of like reduction in texture and pores, and then I have a lot of texture right here in between my eyebrows as well, and I'm seeing a reduction there as well as texture on the sides, and I'm seeing a little bit of a reduction there, as well as same on my other cheek. I mean, I had a lot of like acne scars and acne here growing up, and then of course on my chin. So already seeing some major differences for me, even if no one else is noticing those things about me. It's kind of exciting. So I know that it can only get better from here. And of course, stay tuned to this series because I go in again in early March. And so I will be vlogging again for that entire process and letting you guys know how it all turns out.